Kia ora and welcome back to ECG Boot Camp, an introduction to ECG interpretation by a med student for med students. This is video number 5, rhythm 2. Just recapping what we've talked about so far. So we have gone over a system for interpreting ECG, RRAPWQST. We've talked about how to assess rate, 300 divided by number of big squares between R waves, or number of QRS complexes in the rhythm strip times 6. And we've talked about a system for starting to think about some of the rhythms we need to learn. And that includes, is it fast or slow? Is it regular or irregular? And is it regularly or irregularly so? Is it wide or narrow in terms of the QRS complex? And that is wide if a QRS is greater than 3 small squares. Are there P waves? And how does the P wave relate to the QRS complex? So today in this video, we're going to have a talk about some of the rhythms that we need to be able to recognise. And so we're just going to start with, we're just sort of going to go through this system and interpret a few rhythms together. So this is essentially a normal ECG, and following through our system, is it fast or slow? So there's about, we've used this one before, it's about 4 large squares in between QRS complexes, so it's at about 75 beats per minute. So that's at a normal rate. That's not a tachycardia, it's not faster than 100, and it's not a bradycardia, it's not less than 60. Slower than 60. So this is a normal rate. Is it regular or irregular? So we remember, and I still got my piece of paper where I've drawn the little lines for the QRS complexes for this. So this one is regular. So the same distance between the QRS complexes, more or less. And is it wide or narrow? So between QRS complex start and finish is 1, 2, it's about 2 small squares. So this is narrow complex. Can we see P waves? Yep, so we've got P waves, they're lovely little P waves. And there's one before every QRS complex. So this one is a normal sinus rhythm. So it's normal because it's a normal rate. It's coming from the sinus node, the sinoatrial node, SA node. We know that because there's these lovely atrial P waves. And in ED or whatever, you'll often see it just abbreviated to NSR, or you can call it normal sinus rhythm. All right. And actually, before we move on to that, one rhythm that I haven't written down here, or haven't got an example of here, but that you should be aware of is a sinus bradycardia, which is if it's slow, regular, and has P waves. All right. So we've got a few different rhythms that we're going to work through here. I've sort of got them all off the internet, and the ability to see the large squares and the quality of these is a little bit variable, and the scale of them's a bit variable. So bear with me, and we're just going to make some assumptions as we go, I guess. Cool. All right, so let's start with this one. So following our system, is it fast or slow? There's about 2 large squares between QRS complexes. That's 300 divided by 2 is maybe about 150. Is it regular or irregular? We can do our system, so we can go like this. And that's going to show us that it's regular. So is it wide or narrow? Clearly it's narrow. Are there P waves? Yes, so we can see P waves and we can see them before every QRS complex. So that must mean it's a sinus rhythm. It's fast, so it's a tachycardia. So this is a sinus tachycardia, which is narrow with P waves. All right, moving on to our next rhythm. So is it fast or slow? It's fast. There's kind of just over one large square between QRS complexes. Is it regular or irregular? Again, it's regular. We can use our check, but we can kind of tell as well. Is it wide or narrow? It's narrow. There's less than 3 small squares between the start and the end of the QRS complex. Are there P waves? I can't see any P waves there. So this one is what we call a junctional tachycardia, or an SVT. And so that is narrow, no P waves. And so this is a tachycardia that's coming from above the ventricles, so it's supraventricular, but it's not coming from the SA node. We know that because we can't see those lovely P waves. So it's coming from the AV node or somewhere near it. All right, so this next rhythm, is it fast or slow? It's kind of variable, isn't it? So we'd need a full rhythm strip to count it. Is it regular or irregular? We can tell by eyeballing, but just to make the point of this being potentially useful. Oh, look. This clearly doesn't line up. Doesn't line up. It's lining up again there. Not lining up there. So this is irregular, and it's irregularly irregular. Is it wide or narrow? It's narrow, so there's less than 3 small squares between the start and the end of the QRS complex. Are there P waves? Well, I can't see any convincing P waves. Sure, there's a little bit of kind of jiggling around before the QRS complexes, but there's not this nice uniform kind of P wave coming just before a QRS complex. And so this one is an atrial fibrillation, and we know that that's when the muscles in the atria, instead of those muscle fibers all contracting in a kind of lovely synchronous way, they're contracting kind of randomly and all over the place, and that's just going to mean that the atrium just kind of quivers. And some of those impulses are going to get conducted through the AV node with its built-in delay down to the ventricle. So we're still going to get some ventricular contraction, but that's going to be happening at an irregular rhythm, or it's going to happen irregularly. So this is atrial fibrillation. It's irregularly irregular with no P waves. All right, so this next one up here, is it fast or slow? It's probably okay. It's probably about 75 as well, isn't it? However, that's how fast the QRS complexes are, but the atria are actually going quicker than that because we can see a whole bunch of P waves. We'll come to that in a minute. Regular or irregular? Pretty regular. Wide or narrow? QRS complexes are narrow. They're less than 3 small squares wide. P waves? Yeah, well, we can see a bunch of P waves actually. Relationship of P waves to QRS complexes. We're seeing several P waves before a QRS complex. So we can see up, 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 and then a QRS, and so on. And so this one's what we call atrial flutter, and it's what we call a sawtooth pattern. So if you see that in an MCQ, or if you see a rhythm that looks like a sawtooth, that's usually an atrial flutter. What's happening there, instead of the, it's not quite like atrial fibrillation, but it's another one of the kind of fast atrial rhythms. There's a circuit, an abnormal circuit that's going around and round and round the atrium, so zoom, zoom, zoom. And because the AV node can't conduct as quickly as that's zooming, it's usually zooming at about 300. So you'll get a conduction block where only a certain number of those pass through. So it might be a 2-to-1 block, in which case you'd have about 150 ventricular beats per minute, 150 beats of the ventricle per minute. Or you could have 3-to-1, so you'd have about 100, or you could have 4-to-1, which is I think what we've probably got here, which is about 75 beats of the ventricle per minute. And so the rate is divisible into 300 multiple P's per QRS. And so that's just a pattern that you'll get familiar with, and sometimes people with flutter won't have the same number of P's for every QRS, so you could have a variable block. So you might have 2 and then 3 and then 2 and whatever. All right, so moving on to the next one. So this one, the scale of it's a little bit different. So these, I'm pretty sure that is our large squares here. So just to let you know that. They're not all kind of lined up perfectly. But is it fast or slow? Well, by that it's fast. So there's less than two large squares between QRS complexes. Is it regular or irregular? Yeah, I guess it's pretty regular. Wide or narrow? That's where the useful information comes here. This is clearly wide. So these QRS complexes don't have that lovely recognizable narrow morphology that we're used to. These are weird and wide looking. And so this is ventricular tachycardia. And that is a broad complex tachycardia. Now, there are two things that can cause a broad complex tachycardia. One of them is a ventricular tachycardia, and the other one is a supraventricular tachycardia, like, for example, our junctional tachycardia, with a conduction delay. So one of the bundle branches down to the ventricle can be delayed. We're not going to obsess too much about that, because what we need to remember is that VT is dangerous, and so a broad complex tachycardia is VT, ventricular tachycardia, until proven otherwise. People with ventricular tachycardia can become hemodynamically unstable, and so a ventricular tachycardia without a pulseless VT, is one of our shockable rhythms in our cardiac arrest algorithm. So it's important to start to get familiar with this rhythm. And by a similar token, this last one here, it's not got any kind of recognizable QRS complexes. So when we look at this, we're going to say, oh, it's kind of all over the place. And this one is ventricular fibrillation. So this is when the muscle fibers in the ventricle aren't contracting in an organized fashion. They're just kind of going, that's not going to be enough to push blood round. When blood's not going round and round, your organs, like your brain, are not going to be getting perfused. And so this rhythm is another really dangerous one. And we're not going to spend too much time sort of analysing. If we see one that looks like that, we're not going to kind of print out a 12 lead and obsess about what the PR intervals are or anything like that, because there clearly aren't any. We're just going to hit that emergency bell and get some help from some senior people. So ventricular fibrillation. There's no properly organised QRS complexes going on. There's just this kind of irregular activity that doesn't form any kind of easy pattern that we can see. It's just fibrillating all over the show. All right, so that was the sinus rhythms, and then a few different types of tachycardias that it's important to be able to recognise. In the next video, we're going to have a talk about some slow rhythms, and so I hope you'll join me back then. Cheers.